So today we have Dr. Livia Freier with us. Thank you for joining us. So Livia, tell us a little bit about yourself and the work that you do.
Yeah, I'm a licensed psychologist in Rhode Island. So I'm in private practice, and I specialize in the treatment of anxiety and depression. So most of my clients, they come to see me because they have a lot of anxiety and maybe are going through a really hard time in their life, transitional periods, relationship problems, or maybe they are facing sort of like a long-term depression and they're trying to find an alternative to just medication. Yeah, so those are the people I work with, and I do a little bit of couples therapy as well, family therapy, and a little bit of parent coaching.
Nice. What drew you to this field? What was that thing that let you know, like, this is what I want to do?
Clinical psychology. So actually, I started out in academia. So I was a researcher in neuroscience, actually developmental neuroscience. Always very interested in the brain, how the brain works, and cognitive abilities, how they're developing. Right? You have these babies, they're born, and they, over a very short time, develop a lot of skills, like probably more than at any other point in your life, really. So I was very interested in finding out like what's driving all of this, and how does the brain and biology interact with experience and environment. So I really wanted to study the mind, and how the mind develops. And from there, I then became very curious about executive function. So those are all kinds of mental abilities that have to do with planning and decision making, with attention. That's obviously a very important factor in problems we see all the time, like ADHD or even autism to some degree. So yeah, that's what I did for quite a while, actually. And then I became really interested in sort of more applied science and clinical work, because we do know a lot about the brain, but it doesn't necessarily translate into effective interventions just yet.
So during this time period in the work that you do, have you seen an influx of people coming to visit you?
Do you mean during this time right now that we have?
Yes, during this, the pandemic whole thing and how we've been withdrawn and everybody's in and all of those things. Have you seen an influx of people reaching out to you?
Right. So actually, no, but I suspect that it's not because we have less depression and anxiety. I think there's definitely more of that. And the people that I've been working with for a while, that still see me virtually, they definitely expressed, that they are having an increase in symptoms or in severity, that they know of other people maybe in their home that are now also struggling with anxiety and depression and maybe haven't up until now, or not as severely. So I can definitely sense that there's an increase in all of that. I mean, it's also probably something that most of us can relate to. But because therapy is now delivered virtually, a lot of people, they have maybe hesitations around like how that will work and whether or not that's something that's actually widely accessible, because maybe they had a therapist in the past but they have never been offered teletherapy, is usually what we call it. So they might not be aware that their therapist now has actually moved into the virtual space. So yeah, I'm definitely trying to, let people know that that is a mental health resource that's now very much available, even if that particular therapist has not done virtual therapy before.
Yeah. So I'm gonna backstep just a little bit, and I'm curious to get your perspective on during time periods like this. Why do things like maybe depression and anxiety go up? Or is it because people are now more aware that they were feeling a certain way and it's like, damn, I can address it now? So that's kind of what makes a spike happen?
Yes, Nick, that's a very interesting question. So I think the biggest sort of mental health problem right now is just the tremendous uncertainty that surrounds all of this. We just simply lack the protocol for how should we go about this? Like, what should we do? How should we feel? How are we making decisions? All of that, we just don't know. And we really look for structure and for guidance, to make a decision. And we don't really find that much. There's not much there because really just nobody knows. So we're having to sort of face a lot of uncertainty on a daily basis, and that's very anxiety triggering for a lot of people. Anxiety has a lot to do with sort of like a need for control, feeling that we are in control of our life and of our behavior and our jobs and all of that. And now we really don't feel that we have as much control anymore over what's happening, and we simply can't predict what all of this is going to do to our loved ones and families and to the economy, quite frankly. So, definitely the uncertainty is a really big factor here that drives anxiety and depression. Depression is also related just to the negativity of how the narrative is delivered to us, right? It's everything is very fatalistic, very doomed. If you watch too much media, if you read the comments on social media, we can definitely feel quite low about where is all of this going. And then on the other hand, it's definitely social isolation, right? That is something that can make a lot of people feel really negatively about themselves and about how they relate to others. Simply lacking productivity can increase depression. All of that has increased tremendously for most people, right? There are obviously some people who have maybe never been very social, but even them need a little bit of social interaction here and there to feel that they meet their social needs.
I was thinking about that a long time ago, we spent more time on our porches, knowing our neighbors and things like that, and we stopped doing that. And before all this happened, there was, this talk about, we don't interact often enough with people. We don't get touched often enough. We're like, even if we're all at a dinner table at a restaurant, everybody's on their phone, even though we're together. So it's interesting nowadays to see how many people are actually craving and suffering from having that human interaction. I thought would be good in this day and age.
We go on walks, and when we originally started walking, probably earlier last month, we didn't really see people out. But as the days progressed, we saw people out on the porch laughing, joking.
There's
having
more
a good
people
time
outside now than there ever were in this year that we've been in Providence, Rhode Island.
Yeah, when you really can't have it anymore, right? You might actually become very interested in who is your neighbor. And maybe until now you may have not cared as much. Yeah, and then the other thing obviously is also that we tend to keep ourselves very busy, even if we are not feeling our best. A lot of us have this tendency to just sort of push through, not really acknowledge that we're struggling mentally, and to just sort of either sweep it under the rug or sort of portray it a little bit like this happens to everyone. Everybody is depressed sometimes, everybody's anxious sometimes. And yes, that's definitely true. But it's definitely not sustainable to never address it. So now that some people find themselves with a lot of time on their hands, it can be really hard to sit with that you cannot busy yourself to the point of forgetting every day, all day.
So I have a question for you, because we all have anxiety at some level. How would one know it's time to seek help?
Yes, that's a really good question. So I would say when you have anxiety and you notice that you cannot really function the way you used to, it's definitely indicated to talk to someone, right? So and oftentimes the first place to look is at the basics. So how are you sleeping? How are you eating? Are you taking care of yourself? Are you still interacting with your family and friends, right? And those are all really good places to start. When you feel like it's really hard for you to fall asleep, that's a big sign that something's up, even if you can't put your finger on it. And that's sometimes a problem, that people don't know why they are struggling and don't really feel like they're entitled to go and talk to someone, because they may know someone who has it 10 times worse than them, or because they can't really put their finger on what's going on. But that's okay, because, you know, if you find the right therapist or psychologist, they will help you identify where the problems are and how you can find relief.
Yeah, that was a really good question. I remember I was in college and I went through a really deep depression. And at that time, I was actually in school for psychology. So I was diagnosing myself as I was in school. I was like, man, I'm clinically depressed right now. And I think that was just a transition, what I was going through. But that is a good point of when you can't sleep, and I was not sleeping. That was the highest thing I was not doing.
Yeah, or the opposite, when you do nothing but sleep and you just cannot get yourself started with your day, or you really just lack motivation to do anything, to really just take care of yourself, to go buy your food, to go meet your friends, any of that, it's a really strong indication that something's not right. And it's absolutely fine when you're going through something really difficult in your life, and say you're grieving, or you just broken up a relationship, anything like that, to stay in bed a couple of weeks. There's nothing wrong with that. There's definitely a place for all of that. But if that becomes your life, then it's probably time to really talk to someone and see how to get back into a routine that feels right and that feels healthy, and where you can actually take care of yourself a lot better, right? Oftentimes people who are very depressed, they just say, I'm just really tired. I'm just really tired. This is just, my job is so exhausting. Yes, I mean, that's all very true. It's all true. And might well be true. The job is very exhausting and it takes out a lot of you. But then also, we need to find ways to sort of still engage with our feelings and our lives in a way that feels stimulating and stimulates the mind. And if we're just hiding in bed or on screens, on our devices, then we're hiding from something.
Mm-hmm. Well, a quick question about depression. Is depression something that you think stays with you all the time? Like once you've experienced depression and you've come to terms with it, does it ever really go away? Or is it something that you're always trying to acknowledge and I want to say move away, because you don't want to fall into it. So is it something that you're always kind of like combating with?
That's a really great question, because a lot of people who struggle with depressive episodes, they actually hold on to this belief that they are never going to be free of this. And this is one of the limiting beliefs that actually keeps them depressed, right? Obviously, if you don't think that there is any way to overcome this, then you're just going to put less into even trying to get there. Or maybe you do, but you never really feel like it's quite enough. So I would say depression looks so different for a lot of people, right? We see it in the movies, how people are like truly depressed and, at this extreme low point, but it doesn't always have to look that severe. It can very well be a depression that has phases of feeling like everything is going quite well, and then something happens and it should not be knocking you off your feet, but it does, and you find yourself again in a rather depressed episode. So it can definitely come and go. The really important message is that even if you never know whether you will ever have a life completely free of depression, which you can, but even if you don't know that at this point, it's usually more true than not to say you're not going to feel like this forever. Usually you don't. Usually it is going to change at some point. And knowing that even if it doesn't, even if depression is something that stays with you, you can create a happy life in spite of depression, right? So letting go of that idea that I can never be happy because I have depression really needs to be reframed into I can be happy in spite of depression.
I like it. As a person who has suffered with deep depression, I can say that's the absolute truth. I was fortunate enough to experience it and know that part, that it's not going to last forever. I'm going to get up one day and I'm going to feel less worse than I did the previous day. And that's just going to gradually continue to happen until I'm back to normal again. But that is true. Like having that idea that it doesn't last forever helps so much.
Especially when you are at the point where you feel like suicide is your option. It's so important to come back and say, no, you think that because you are depressed, because, you know, our emotions inform our thoughts and vice versa. So you think this negatively because you're feeling really, really bad. And once you feel better, you're not going to think like that anymore. It's definitely going to change. So knowing that as like a fact can definitely provide some comfort to get you through some really rough times. But I would absolutely talk to someone and see some specialists if you or you're someone you know is at that point. Yeah, it should not get this far. This is unfortunately also a problem that sometimes we don't seek help until we feel extremely depressed or anxious. Yeah.
Right. So I guess there are signs to where you know you need outside help. For those of us who are kind of reluctant to reach out yet, for example, especially that maybe we were fine, but these times kind of put stress on us, how can we self-heal from anxiety during this time? What advice would you give people to have?
Important. That's very important, because if this anxiety is something that has always been a problem for you, excuse me, then just have a quick break.
Yeah.
Is someone just not on my book? I guess not. So if anxiety is, oh yeah, oh just a second. Sorry about that, wrong door. Okay. So yeah, so if anxiety is something that has affected you for some time now, it makes absolute sense to explore what's happening with a really good friend, with a professional, with your doctor, right? Like, starting anywhere really is great, but you can also do things right now to make you feel better in the moment, right? Is it going to do all the healing? Probably not, right? It will allow you to, have a better experience, to have, to get through your day, and to have, just taking the edge off things. So things that you can do right now that doesn't require you any sort of introspective work or a ton of time committing to therapy are usually things that are related to mindfulness and mindfulness-based practices, where you bring yourself back into the present moment. That is important, because your brain really can't do both. You can't worry about the future and be right here, right now. It's just, attention is very limited. It's a limited resource, and we simply can't do both at the same time. So when you feel like you're about to have a panic attack, or you're just extremely anxious, where you feel like it's spiraling out of control, it's good to do something that involves the senses. So for example, touch is very powerful. You could run your hands under cold water, or go and get an ice cube and just hold it in your hand, really sort of sinking into what does it feel like holding this ice cube, and what am I noticing? How would I describe this to someone? And why not just as well describe it? Like, say it out loud. What are you experiencing doing this? Same thing to describe something that's occurring visually, that looks great in your car when you're driving along the street. And driving is often something where our thoughts sort of drift and wander. And yeah, sometimes it wanders to a place where we feel anxious. Bring yourself back into the here and now by talking out loud. What are you seeing on the street? Like, what are you hearing? What is happening? And you do that for like 5 minutes until you feel like the anxiety is sort of starting to reduce itself. And then obviously meditation, that's very important. Try to meditate every day. There is so much evidence that shows how meditation can help us reduce anxiety and also help with depression. And those are fMRI studies that look at the brain that show that yes, having a good meditation practice can really go a long way.
Yes. So for somebody, because for example, I have a hard time reaching out for help. It would have to be something, gosh, even if it's between life and death, I might not reach out for help. wanting to do everything myself. So I guess I would want to ask, what signs then would you give somebody where, okay, you know what, you probably need to reach out for help? These signs, like if you've reached those, if you're experiencing this, it's a good time now to kind of reach out and find somebody who can help you.
Yeah, so, you know, I mean, I'm a psychologist, so I actually feel that everyone should have a psychologist. Even if it's not something that you feel like, okay, I'm now at the breaking point, because oftentimes, like I said before, we shouldn't let it, you know, this is a life we're talking about here. It shouldn't come this far. So, and it's absolutely so helpful to talk to someone who you know is not going to judge you. The consequences of what you're saying is not going to affect them in any way, and it's just really helpful. It's almost like having your primary physician who you check in with once in a while. It doesn't need, you know, maybe the standards of going to a session every week, but maybe, you know, once in a while, like every couple of months or so, can be really nice, just to reflect with someone who has some training on what's going on and whether you're feeling like you're getting somewhere with your self-improvement work, or maybe you want to improve the quality of your life in some other ways, right? But to answer your question, good indications are, like I said before, when you feel like, you know, the basics are of your routines are maybe not the same anymore, you have difficulties relating to other people, or you kind of feel like you're starting to judge yourself, right? That can happen a lot for people who have anxiety, that they start sort of judging themselves for being anxious on top of experiencing anxiety, almost like, oh, you know, this is just, here we go again. This is anxiety, right? Very negative self-talk. So any sort of like negative self-talk is a good sign that this needs to be fundamentally restructured with a little bit of help, because we should never really talk to ourselves in such a way.
All right, I've got another one. So it makes sense, for example, as massage therapists, do you go seek massage therapy? Yes, of course, because you can't do that really for yourself. But it's interesting when we ask, for example, people who channel, for example, or psychic, do they go to somebody else, you know, for that help? So you being a professional in what you do you seek help? Do you?
Oh, yes, absolutely. Yes, I think that most psychologists should have psychologists, and that doesn't mean that it has to be, you know, all the time. You know, pretty much to what I just spoke about like checking in and out. And sometimes this could be even just a colleague, but actually it would be really great if psychologists would have their own psychologist that they would maybe consult with once or twice a year or more, because, you know, also psychologists get divorced and have life or grief, the loss of a loved one, and, you know, it's a long life. So it would definitely be really, you know, really indicated for psychologists to also see someone. Personally, right now, I have to admit that I don't, but increasingly now with the pandemic unfolding to such a degree of intensity, more and more mental health professionals are also getting mental health resources, and especially also, you know, everyone working in the medical field, and because they have been impacted so severely. Yeah.
This, to me, I haven't really formulated the thought of it, but I find it very interesting, because I was thinking, you know, when I asked you, how would we know when it's time to reach out to a professional, you know, with anxiety, for example, or depression? And then I'm thinking, okay, well, because they know something we don't. We can only take it this far, helping ourselves in this department, but they have knowledge that we don't. And it's interesting because you have the knowledge that you need to help yourself, but this interesting point that we need others.
Sometimes we do. It's always nice to actually having to formulate a thought, because a lot of that stuff is so, you know, automatic in the back of our heads that we might not be very conscious that we're holding on to some beliefs that are not working for us. So, you know, having to sit down and really explain to someone what's going on can be very eye-opening. And, you know, this is why a lot of psychologists, they don't necessarily say as much. They really just let you sort of do a lot of the self-discovery work, which works great for a lot of people. And then some people, they need more prompting and more directive approaches to really get there. But that formulation alone is very, very helpful in sort of understanding, oh, I guess, I can see how something that's happening here is related to something that's happening there. So and it's also nice to have, like, just someone's opinion and a fresh perspective, helping you understand a little bit, even just with some, questions.
Yeah, I'm thinking that's probably why psychiatrists were invented. Back then, when we had a more integral family structure, community structure, where you had your elders, where you had good friendships, that's what happened. You had time in your day to sit and discuss things with your aunt, with your cousin, with your neighbor. Those afternoon hours on the porch, which have disappeared in this day and age for many of us. And it's like you said, it's sometimes hearing yourself speak, having somebody ask you a question, and that could be the turning point of making you think a little bit differently.
Definitely.
So
this is you pretty much described therapy just now. This is pretty much it. But that's why therapy is so stimulating. It doesn't just give you all the answer. It really helps you sort of work together, really collaborate with your therapist, and see sort of how, what makes sense for you and what's important for you to understand. Because this is not about analyzing anybody. This is about, you really want to understand how to help yourself. And you don't want to go to somewhere and say, okay, this is what's happening, give me the answers. Because they can't. I can't tell you what's right for you, right? I can obviously help you sort of, get there until you really know what's right for you and you have like a visceral understanding. You know what's right for you, which is, really great when you know that that's achieved. But I cannot tell someone what's right for them. And this is also why it's nice to have a psychologist. When you have a hard, difficult situation, say at work or in a relationship, and you go and talk to a friend or family member, and they are so quick jumping in with suggestions, right? Well, you should just break up, or, I would do this and that. And I know it doesn't matter what happened. I cannot tell you whether this is the right decision for you to make at this point of your life. It might definitely be the right thing to do for your neighbor or for your friend, but it may not be the thing that's going to make you happy. It's going to make you feel like you're living a meaningful life. So, nobody can really give you the answers, but we can definitely work together to get there until you feel like you absolutely know what you want. And you can make a deliberate decision and then really stick to it. And obviously also adapt if needed, but knowing that you're thriving and not just getting by.
Yeah, exactly.
So there's a quick question. This is something that we've been developing for a while. It's a question, I guess, for people like you would fit this question very well. It's called How I Human. And what the question is kind of based around is, with all the knowledge that you have, how does it help you move throughout life? Can you sense a difference between before you had this knowledge and now? It's like, I'm humaning a lot differently now. I'm humaning better, maybe.
Right. So that's a really interesting question, but important to know also, like, yes, you do study psychology, but you don't necessarily work with all different problems, psychological problems that can arise, or all kinds of mental illnesses that can occur, right? So most psychologists, they find their niche, and then they sort of like work within that niche. So, my niche, for example, is anxiety and depression. So I look a lot at the research here, follow up with new interventions, look at the studies, all of that. And I can confidently say that if something in my life happens that affects my level of anxiety and depression, I kind of know how to go about it. But, maybe, something else happens. Maybe there's something that's related to maybe grief, or, no, actually that's pretty related, but say a problem that has to do with, say, OCD, for example. OCD specifically is something that I know because I study neuroscience, and because, you obviously are trained in psychology. but it's not something that I'm up to date with the latest research, because that's not my niche. So I would definitely know if someone will have that problem and that's the primary symptom, I would refer them to someone who is an expert in that, right? And it's a little bit like thinking about, yeah, they are, you definitely have your primary doctor, but sometimes it's time to see a specialist, and that. They don't, it's not one doctor can help you with all of your problems best. They might be able to help you a little bit here and there and to have like a general understanding, but to really understand it, you need to be referred on to someone else. So I'm not really sure if I answered your question really well here, but I think it ties back into what we said earlier about psychologists having a psychologist. It's a little bit like saying, a physician doesn't need a physician, because I'm sure that they may not go as often, unless there's obviously a condition that they will need continued care. But they will probably still have their own physician, and I'm actually pretty, confident that most of them do still go for regular checkups. So, that's something to think about. It doesn't necessarily make a mental health trained professional expert in everything psychology, but definitely in some areas. And for everything else, then it's good to talk to someone who is an expert with that specific aspect of life.
All right. So we've got people watching this on YouTube and really connecting maybe with you. You practice in Rhode Island, and you were talking about referrals, so that made me think, who can come to you?
Right. So I actually, I practice in Rhode Island, and this is how it works, that you see residents of that state within you are licensed, which is Rhode Island. But right now, during this time of pandemic, I'm also providing teletherapy to Massachusetts residents, because it has become very problematic for a lot of people who may have come here before to still talk to a therapist, because they live maybe just across state lines. So those very strict licensing restrictions have been sort of have been for the time being relieved a little bit, but it's probably going to go back to it's probably going back to just staying within Rhode Island after the pandemic has sort of lost its like emergency status. But anybody who wants to have teletherapy can get a phone call. I'm always, even when I don't have available sessions, I really like to give people resources where to find a therapist, because I know it's actually really hard to find a therapist, because there's people sometimes don't even know what to ask, and a lot of people, a lot of therapists, they don't offer a free like first phone consultation, so people feel like they're kind of pressured to book a session when they're not really sure whether it's a good fit or the approach suits them. So I really like to help people find a therapist and give them resources, make them understand that they don't have to understand like every last ramification of psychology in order to find a good therapist. Like, it's really good to know questions to ask in your first session or on the phone, and then really take it from there. And more than wondering too much about the sort of theoretical background, I would say go by your instincts and by the the sort of like communication you have with the therapist.
Yeah, the rapport.
Really look at it as a good fit, because that is what studies show is one of the biggest predictors for therapeutic outcome, is how committed you are to therapy, and to sort of like continue therapy, and the fit between therapists and clients is very, very important, right? So with me, I have a website. It's called www.mindwell.life, and there's a contact form. It's all HIPAA protected, so you can just leave me your name there and email address, and I give you a call back, and we can see whether there's an available appointment for you, or I can help you find someone who still takes on new clients, who can work with you wherever you live, and who has also the characteristics that you feel like are matching, right? Because, for example, you might feel like you really don't care whether you work with a woman or a man, but that's not true for everyone. Like some people, they really feel like, no, actually, I want to talk to a woman about this. This is a woman's issue. I feel like a woman could relate better. Let's look at female therapists, or quite the opposite. And there are really fantastic therapy directories other than psychology today out there. For example, therapy.com, you can really search by any sort of therapy approach or therapist characteristics. So say ethnicity, or whether they are spiritual or not. And they also do a lot of, sort of like alternative approaches. Like it's a really great directory.
The effectiveness of teletherapy, you feel like it has been something that is helping tremendously with the field of psychology?
Yeah, so to say that something is effective or not, we really need to look at the empirical studies out there. So basically looking at, following a lot of clients who have been seeking teletherapy, and then looking at, is it working for them? We have to sort of find a way to assess how they're doing cognitively, what's going on emotionally, what about, everyday functioning, is that improving? So, it's we just don't have those studies yet. We do have them for some approaches. So CBT, cognitive behavioral therapy, for example, is a preferred modality because we do have those studies that show it is effective for people with anxiety and depression, and for all kinds of other mental health problems as well. And it's also very much a course of therapy that is very pragmatic and you can see outcomes very quickly. So CBT is a really good one because you can also do it all teletherapy, right? There's nothing really hands-on happening here. There's nothing to to remove. Like it's pretty simply, you can actually pretty simply convert it from an in-person session to teletherapy. That's not necessarily true for all different lines of therapy. So we really would have to conduct some studies here that are randomized controlled, follow different approaches, and then look, are they working for people with specific mental health problems? But overall, looking at, for example, mindfulness-based practices, CBT, and acceptance and commit as well, we do have some studies that show teletherapy is as effective as it is in person.
Nice. Wonderful. I can't think of, can you think of anything at all?
No, I think we'll put all the links that you mentioned, your website, and we'll put the description below.
Yes. Actually, something I forgot to mention is, like, on my website, there's a blog post about how to find a therapist near you. That can be a really great place to start, because in there are also the different questions you should absolutely ask your therapist on the phone before your first session, right? And if your therapist doesn't take time for that, it's probably not the right fit. It probably isn't.
Right.
Wonderful.
This was good. This was great, and we thank you for this.
Yes.
I feel like it's very helpful during this time period, during all time periods, but during this time period specifically, it's needed.
Yeah, well, it's always nice talking to you too, and anytime, give me a call. This is
Yes, definitely. We should have more of these sessions as time goes by. Different questions, different things that we need to talk about.
Yeah.
We thank you. We thank you for your time and for your energy. I know a lot of people will really appreciate this. The resources.
Well, anything that helps, and anything that also helps with raising awareness for mental health, quite frankly, right? I really wish that a lot of people would have a regular routine of checking with themselves, or even thinking about overcoming their inner sort of doubt and stigma to talking to a therapist, which is still very much a thing for a lot of people. So I really hope that we can have conversations like that make people understand, finding a therapist is it's not something that is, extraordinary. It's actually really quite normal, and a lot of people have very good, trusting relationships with their therapists that last for many years.
Yeah, absolutely.
Yeah. All right. Until next time, we're gonna do this again. We're gonna do this again.
Yeah, nice seeing you guys. I hope you have a really great rest of your day and a really good weekend. Hopefully this weekend we'll see some sun. I think that is also part of this. It just hasn't been a very good month here. So being stuck at home was extra hard. But hopefully this weekend you'll feel like it's spring and we can feel more hopeful.
Absolutely. Thank you so much, Livia.
Thank you.
Thank you.